I'm here to present AB 2087, which will protect lives by ensuring that the level of care sold to patients aligns with what is being advertised by providers and what they're licensed to deliver. I'd first like to thank your staff and yourself for all of your hard work on this bill, and note that I will be accepting committee amendments. The need for this bill is particularly acute in businesses that are offering drug and alcohol treatment services. And I'll share just one story by way of example. In my district last August, a 23-year-old man who was living in an addiction treatment facility in Newport Beach left the premises exhibiting signs of paranoid delirium, having received a cocktail of contraindicated medications. Tragically, he broke down the door of a nearby residence and was shot and killed by the neighbor. It's clear that this young man should have been in a facility with much greater supervision and monitoring of his detox. This tragic example really does highlight, in my mind, the need for this bill and the need for us to strengthen oversight when it comes to the distribution of medications, particularly in recovery residences. One thing that we have seen is that right now it is currently an uphill battle to stop these dangerous and unfair business practices, and patients and their families really are best positioned to identify rogue practices and rogue facilities. False advertisement, providing services by untrained or unlicensed staff really is unacceptable and dangerous, and we've got to provide a path to stop these practices and these unscrupulous operators. This bill does that by doing a couple of things. Number one, enabling patients and their families to take civil action to hold unscrupulous recovery facilities accountable for dispensing prescription drugs without a license or falsely advertising a level of care. And number two, authoring the recovery of attorney fees to a prevailing plaintiff. Joining us right now to testify are a couple of individuals who have experienced these rogue facilities. Wendy McIntyre's son, Jarrod, passed away in a rogue sober living home, and we have named this bill Jarrod's Law in his honor and memory. And we're also joined by Christian Atchison, who is a former recovery patient. Wendy, thank you for being here.
My name is Wendy McIntyre. I'm a public safety advocate in California. I'm here because of Jarrod's Law. My son died from an overdose in a sober living home 17 years ago. The staff responsible for his care did nothing to save or revive him. He was left aspirating for hours alone until his last breath, all while the fire department was just 2 blocks away, but were never called. This complete negligence and lack of care opened my eyes to the unfortunate fact that I am not alone. Families continue to send their loved ones to treatment in hopes of them finally getting help. Only their loved ones are facing circumstances much worse than addiction. After starting Jarrod's Law, I had made a startling discovery about treatment facilities that deceive the public so they can profit off vulnerable people. The worst part is that deaths at sober living homes and treatment facilities continue to pile up and seem to go unnoticed because nothing prevents from the public from being properly informed about what's going on. This bill ensures that a proper level of treatment is received for people seeking recovery at that facilities are held accountable for their actions. We need to close the loophole that would require a license if medications are being administered. Currently, facilities are making patients self-administer their own medications to avoid licensure. This is extremely dangerous practice and it needs to stop. I appreciate Assemblywoman Cotty Petrie-Norris for her continued support and dogged determination for protecting all of our loved ones. And I want to thank the members of this committee for your time.
Thank you very much. Mr. Atchison.
My name's...
And do me a favor, hit the button right there. Thank you.
Hello, my name's Christian Atchison from San Diego. I also applied Assemblywoman Cotty Petrie-Norris's initiatives with the care and the continuity of care these recovery homes need to have. I had responded to an advertisement by Pacific Shores Recovery, LLC, advertising substance abuse care and mental health care as a licensed 6-bed facility with a staff of 13. I arrived September 2020. They had advertised for $120,000 for a 6-month program. I had been admitted for possible surgery across the street at Hoag Hospital for a vertebral burst fracture that happened months prior, and for treatment for my post-traumatic stress and the way I handled my pain. Upon admittance, witnessed there was a co-ed facility in one building housing 12 males and 12 females, in addition to the 6-bed licensed facility that I was in. I became aware that they were offering fraudulently through advertising, providing medical services for 30 to 75 people between Costa Mesa and Newport Beach, and adjacent to the Santa Ana Heights neighborhood. That's been problematic. There was a house tech working out of the garage, administering morning, noon, and evening meds, administering, monitoring, and logging for compliance medications in the garage at the unlicensed and unpermitted and sanctioned home in Costa Mesa. They were operating as a hybrid after Costa Mesa's injunction, and they were supposed to be just a landlord. They were a mirage. When I was curbed because of house policy, the doctor increased the dose, changing the meds, and took meds away without waiting for efficacy or from a word from my psychiatrist at the Veterans Administration. And outside of medical protocol, I was curbed by the house CEO. Well, after they curbed me, my insurer said they continued to order medications in my name. I was homeless for 3 weeks without them knowing my whereabouts until I was received at Northbound Recovery, whom they are integral and affiliated with. Inconsistent with community care facilities employing 144 staff with a legitimate ratio of staff to client, they only employed 13. 1 doctor, 1 primary care, 2 social workers for upwards of 75 people. These frauds cost me thousands and made me homeless. Their lack of reasonable accommodations caused further damage to my vertebrae, and other clients, two of which I am aware of, had died within a 6-month period in both from both Costa Mesa and their Newport Beach facilities. They feigned entitlement to constitutional remedies and protections and were denied continued operations. Pardon me.
Maybe if you get a chance, maybe to conclude, that'd be great.
That's what I'm trying to do.
Appreciate it.
They had feigned entitlement to constitutional remedies and protections in the Ninth Circuit and continued their operations despite local law. And thank you for hearing me, and thank you, Assemblywoman.